So one of the most common injuries when it comes to the back is something what we know as slip disc. So slip disc, okay, now what is this slip disc? Everyone says slip disc. Okay, so slip disc is a jargon. It is basically something that lay people use, but in reality it is what we call as, in the medical world, as herniated discs. So in slip disc or herniated disc, what you can see clearly here is this red thing that you see. So this particular thing is basically your disc, and there is something called as a nucleus which is present right in the center of that disc, which gets pushed out towards the side, as you can see here. And sometimes when it gets pushed out, it can also press on this nerve, this yellow thing that you see, this yellow thing right here. It can get pushed onto this, and then this is something that can cause pain that radiates all the way down to your leg. So this is one of the most common thing that people suffer from. As I was saying, just because a disc came on an MRI that it was slipped or it was out, as they would put it in the layman's term, is not necessary that that is the cause of your back pain always. Because if you take an MRI of a normal person, say 10 normal people, maybe out of 10, 9 people would have a slip disc which is not at all symptomatic, which is not at all causing any problems for them. So this is something people need to realize, because everyone has some particular opinion about back pain. So usually someone would tell you, oh, you don't need to move, you should be careful that you will get paralyzed, you should be careful that, you know, there might be severe consequences on your life, you may not be able to work. So that we get a lot of cases like this who get afraid and are afraid of back related issues because of this constant barrage of information that they get from different sources who had themselves suffered this in the past. So this is something people need to realize, is that the problem may vary, but unless a proper assessment is done by your physio or your doctor or a certified medical practitioner, it's best to not diagnose yourself, and it's best to let the professionals do their job and to assess you and then make a good plan or a call on what to do next. So coming back to the disc bulge or the disc herniation or slip disc, as we mentioned earlier. So there are 4 grades in this particular condition. So grade 1 basically means that the nucleus which is in the center of the disc has pushed out slightly, and that has caused some inflammation and is causing some back pain. Grade 2 basically means that the nucleus has torn further and has pushed in further. Grade 3 means that it is completely almost out and almost pressing onto your nerve or your spinal cord, depends on which direction it has protruded in. And grade 4 basically means something called a sequestration, which means that the nucleus is completely moved out of the disc and is currently in the spinal canal or has moved into any open space that is available for the disc to get into. So apart from grade 1, 2 and 3, usually 4 means it's better to visit an orthopedic surgeon and to discuss the best plan of action. Grade 1, 2 and 3 usually can be treated with physiotherapy and has really good outcomes when it comes to proper management and care. One thing people need to realize about back pain, that it is best worked with a multiple team scenario. Basically, with the back pain, it is best that you work either with an orthopedic surgeon or with a neuro specialist. You work with a physiotherapist for exercises and rehab. You control your nutrition, your diet. So all of this together as a team is something that helps you recover from back pain. So the general consensus, however, for people to remember is that back pain can take anywhere from 6 months to 2 years to heal. I mean by if it is a disc related issue, right? It can take anywhere from 6 months to 2 years to heal. So that's the amount of duration that discs take to heal. So there are times that when you get a disc problem and it was symptomatic, and then you start doing some treatment and it feels better, and then after you did something it comes back in again. So that doesn't mean always that you have aggravated the injury. It could just be a flare-up which has happened because the problem has not yet completely healed, although the symptoms had disappeared. So this is something to keep in mind about disc bulges and back pain. There was an age-old adage that, okay, if you had disc bulge or you have any slip disc, as people would say, is that, okay, you should take rest. Okay, one thing that people need to realize is that was the olden method, or that was a very old and conservative method where you would take rest for after a disc bulge. The current research and the current evidence states that you should be moving, you should be exercising, you should be allowing for the mobility in your spine to be increased and worked on. So this is something that people need to realize, is that fixing yourself of back pain sometimes is not just a quick fix, but is a process that you need to follow. And this is something that we as physiotherapists and your doctor would be able to best guide you towards. So in the future, if you are suffering from any or if you are already currently suffering from any back pain related issue, please do visit your physiotherapist. You could visit us if you're in Goa or in Bombay, and we would be glad and able to help you out with regards to this issue. And it is something that you do not need to suffer with all your life. It's not something that you give up on and say, okay, you know what, this is something that I have and I have to live with this. This is not true. This is something that you can fix. It just takes some time. You can fix it with rehab. You can fix it with good and proper exercises, with strength, mobility. So this is something that people need to realize and change their mindset about back pain, is that there is no one quick fix. And if there is a quick fix, it is maybe a small issue or a minor issue, which is not something that was major in the first place to begin with. So if you have any more doubts or any more questions, please feel free to contact me or anyone in my team, or you could just drop in and visit us at any of our clinics in either Panjim or Margao or in Bombay or in Vasco, and we would be glad to help you out. So wish you a healthy back. Okay, hope this video was informative, and for any issues that you have, and if you would like to get in touch with us, kindly find the links to the side or above, and you could just get in touch with us online, or you could visit our website and get in touch with us via the contact form. We are equipped right now to help you all with on-field as well as off-field, as well as general musculoskeletal rehabilitation and treatments, and a wide variety of conditions is something that we treat here. So yes, if you would love to get treated by us, please do get in touch and we would be glad to help you out.